Welcome back to Local Doctors on Call. Today we are being joined by Dr. Ed Stolarski. He is an orthopedic surgeon specializing in hip and knee surgery at Doctors Hospital here. And right before the break we were talking about medical tourism, which is a very big buzzword right now in the industry.
Let me explain how I got into medical tourism. I've had a lot of patients come from outside the country, another part of the country, snowbirds for instance. That's pretty much how it started. But then people from Europe and Japan started seeking us out. But what do we do with them? They come here, we replace their joint, and they stay in a hospital for a day or two, maybe 3. Where do we send them? A hotel, their friend's house? Medical tourism is a group of people together with different answers on how to bring someone into the community, get their joint replaced, have it done well, and then have them post-operatively taken care of without doing anything dangerous. An example would be, we had a patient come in from Brazil, replaced their joint, they had a total hip. They went to the Sarasota Bay Club after their hospitalization. Now their family has the option of staying at the Towers, which is a very, very nice condo on the water. They stay for about 2 weeks. I see that their wound's doing well, they're progressing with therapy, and they don't feel like they're part of a mill. It's excellent. It's really a nice way to have your joint replaced. And
do you go there and do the after care with them over where they're staying, or they still have to come into the hospital?
They usually come and visit. I'd love to take the time to go over and visit with them, but it's just too busy. But it's not far from the office. They come and visit 2 or 3 times before they head home.
And I guess if you're having the surgery and you're not crazy about your family, you can always have them go stay at the hospital.
That's right.
There you go. All right, we're going to go ahead and take one of the email questions that have been sent in. And this one says, how long will I have to stay in the hospital after my procedure? And this is from Jackie in Sarasota. She wants to know how long she'll have to stay in the hospital.
Depending on the operation. Let's go through the simplest to the more complex.
Okay.
A partial knee can really go home the same day, but we usually keep them one night. Total knees, I like to keep 2 or 3 days. And anterior total hips, people that are healthy go home the next day.
Now, why would someone that has their knees operated on have to stay in for a couple of days? Is it because of the walking?
The main reason for me is 24 hours of post-operative antibiotics so that they don't get an infection, and to make sure I have the right amount of proper pain medication. I don't want them to go home waxing and waning with their pain. I want a constant pain relief. I could do a great operation. If their pain's not under control, they're going to remember that, not the operation. We do a lot for pain. An example with a total knee, we use regional anesthesia. That means we'll give them a spinal. Then we'll use something called a femoral nerve block, where we'll put medicine right near the femoral nerve, and then we put a cocktail in the knee. So as they wake up, they don't have any pain. As it gradually comes on, we stay ahead of it. And that's one of the reasons we keep them a couple of days.
Are any of these knee surgeries done when you're awake at all with or?
You have the option. I mean, I don't want to have a conversation with you during the operation, but you do have the option to be as sedated or as awake as you want, because the spinal makes you numb from the waist down. The benefit of that are 3. 1, you wake up in no pain. 2, no breathing tube.
Sure. Less
pneumonia, less barotrauma. And the 3rd is reduced risk for DVT, which is a blood clot.
Okay.
Joint surgery is a
why is there less risk for a blood clot?
Vasodilatation, dilation of the veins in your leg.
Okay. That's interesting. I know that I would happen to be one of those people that would probably opt for being awake, and I'd want no anesthesia. I'd be wanting to ask you questions about it, you know, but I'm sure you far prefer it when they're singing.
We would give you enough medication. It seemed like you had a couple cocktails.
Right. Okay. So let's take our next question. How long is the recovery period? Let's go into that.
It's a great question, and I'm going to talk more about primary joints rather than revisions, because revisions are so complex, or the redos are so complex that it varies. But a primary hip goes home the next day. We'll be driving in about 2 weeks. They're swimming in about 4 weeks.
Wow.
Golf, which is important down here, they're starting to hit golf balls at about 2 weeks after their incision is checked and their staples are out. But they're playing games at about 6. Tennis, I make you wait 3 months.
All right. Let's take our next one. Surgery always makes me nervous. What can I do to be better prepared for the big day? And this is from Eileen, Holmes Beach.
That's another great question. Stay in shape. Don't let your knee or hip be a reason to sit around waiting for your surgery. Even if you just go for a short walk, do something to get your legs stronger, keep you motivated. Exercise before surgery is a great indicator on how you're going to do post-op.
Now, are there some exercises that you, as a doctor, if someone comes in and says, I'm thinking about getting this hip or this knee surgery, but are there some exercises that you can give them to gear them up a little bit for their surgery?
They can always take a sheet from us, but really what's nice, if we can get them pre-operative physical therapy. Just one session to let them not only go through what they can do to get ready for the surgery, but what they're going to expect afterwards. No one's used a walker or crutches for most of their life.
Sure.
Show them how to use a walker. Show them how to use crutches. So preoperative physical therapy is excellent.
Right. We have another question. What are the advantages and disadvantages of the minimally invasive method? We'll probably have to describe that a bit too.
Yeah, minimally invasive. Again, if we talk about hips, we're talking about cutting less muscle, being more accurate, and having less restrictions. With the anterior approach, what we're doing is the patient's on their back for the surgery. We go between two muscles. We don't cut any muscle. We bring an x-ray machine in during the operation to make sure the implants are right. That's how we make sure that the thing's going to last a long time and not dislocate. And that's why they were able to go home the next day for the most part, because we are minimally invasive. Now the downside, if you're not trained in minimally invasive surgery, you're going to have more complications. It's almost like working on your car, just lifting that hood up a little bit. We better know what you're looking at.
Well, hopefully, you know, when someone is doing one of those kinds of surgery, they have good training, and by your resume, you've been trained by the best places. So, and you actually, you write a lot of papers about this stuff too.
Yeah, we have a lot of papers. We have a ton of raw data. With the anterior hip, we've done about 1,700 of them, and so that data we're trying to get together and publish. But research assistants aren't inexpensive.
All right, let's take our next question. How long does the surgery take? And this is from Greg. He's in Venice.
I guess the right answer, without being smug, is as long as it takes to get it right. A typical partial knee will take about 30 minutes, a total knee will take about 30 to 40 minutes, and a total hip, depending on the body size, like your small size would be about 30 minutes, but a big muscular guy, like the guy with the giant hands, might take 40 minutes. So the length of the surgery is not bad, but it's really getting it done right. No one's interested in speeding through the surgery.
And do you actually do you put people in any kind of motion after that surgery because it's a joint as opposed to? The
CPM machines, or continuous passive motion machine, it's a machine that'll bend and straighten your knee after a total knee. Actually, the studies show that they don't improve your range of motion. What happens is you think you're bending it, but your butt is just sliding on that machine. There's a slight risk for peroneal nerve injury from the way your legs lay on it. So what we do, we have aggressive physical therapists instead. So we make sure you have therapy twice a day, and they do that rather than a machine.
And about how long for the therapy?
Depends on your insurance, unfortunately, but typically an hour would be good, hour twice a day.
And of course, if someone wanted to pay for it themselves afterwards, they could do that.
Yes.
We have one last question before we go to break. So how do I know if I need surgery? And this is from Lisa in Bradenton.
Need surgery. Well, to make it simple, there's a line drawn in the sand by the patient. How bad is their life after this arthritis onset? Is it impeding them? So you'll come into my office with x-rays. Your x-rays may be devastatingly horrible and you're doing fine. You're not ready for surgery yet. Or you might come in with moderate arthritis and you're really doing poorly physically. So a couple criteria. One, I have to think you need surgery. The x-rays have to kind of bear out the fact that you have disease, and you have to be impeded enough that you want to undergo the risks. Best example is this. I wouldn't replace your hip so you could play tennis, but you should be able to play tennis after I replace your hip. So.
And what happens if you get somebody like me that's a high pain tolerant person, and yet you think they need the surgery? And
I would just watch you. We would do everything. It sounds kind of hypocritical. I don't want to operate on you. I'd rather be able to treat you medically and keep you functioning, because that's my job, right? Keep you functioning. If I can keep you functioning without surgery, then I'm doing a wonderful job. Injections, physical therapy, you'll decide when you have surgery.
Alrighty, on that note, we're going to go ahead and take another break. We are being joined by Dr. Ed Stolarski from Doctors Hospital, and he's going to tell you a lot more about hip and knee surgery when we get back, so stay with us.